Since the beginning of the COVID-19 pandemic, one of the biggest shifts in mental health services has been the rise in online or telephonic mental health services. Now, insurance companies and legislators gathered together really quickly to break down a lot of the barriers, the administrative, the legislative, and the insurance barriers, to people being able to provide mental health services using phones, webcams, chat, that sort of thing. And one of the things that's been great is that it's allowed people to access these services while they're at home. Now the question is, do they work? Well, what's true is that we have been using phone-based mental health services for decades. And these are in the form of crisis hotlines, crisis helplines, and lifelines. And there's a lot of evidence to show that these are really effective at decreasing behavioral and psychiatric crises, as well as reducing suicide risk for some people. Now, what we also know is that there's about 20 years of research that says that online therapy services are just as effective as face-to-face therapy services at reducing symptoms and improving functioning. When you talk to people who have been involved in online therapy, they say they feel that their counselors get them, that they feel connected to them, that they feel supported, just like they do when they see face-to-face folks. Now, this doesn't mean that the same person who sees an online therapist will feel the same way about seeing someone face-to-face on the ground. But it means that on average, people who see folks online have the same quality of services as they do when they're offline in person. So the good news is that the services that people are being provided, even though there's been a shift in how they're being provided, are effective. Now, one of the great things about this is that it's provided sort of a natural experiment in providing mental health services in a different way. And it's called attention to the need to make permanent these changes in insurance and legislative policies so that moving forward, we can make sure that we are breaking down the barriers that have existed for decades that have prevented people from accessing quality mental health services.